to make sure everybody knew that. And I think everybody who's on here so far knows me. I'm Joanne Stevelos, and I am the creator of Worthy. And I wanted to introduce you to Marie McCormick, who's our moderator for the day. And what she'll be doing is just watching in the chat box for any questions or comments. And then she'll also be sharing with you some of the resources that we provide in the Worthy program to parents and professionals. So why Worthy? In 2007, a study came out that showed that children who have gained too much weight too fast feel emotionally worse than children who are undergoing chemotherapy. And this really actually made my heart break, because one of the things that we know is that children with too much weight often are being bullied or have weight stigma or facing a lot of challenges in our society that's really focused on thinness. And it occurred to me that if we provide children who have a serious disease as cancer, why can't we do the same thing for children who have a metabolic disorder or who have gained too much weight too fast? You know, in children who have a serious illness, there's things like the Ronald McDonald House, and parents come around the child and the community shows up and really supports that child. But we don't do that for children who have gained too much weight too fast. And so this was the main premise of Worthy, was how do we help parents feel that same love and kindness as they struggle in this obesity epidemic? So that to me was the beginning of Worthy, and it's been 4 years in the making. During that 4 years I've been developing this program, there's been two major trends that are also informing this work. And the first one is there is an increase in severe obesity among children ages 2 to 5. And then sadly, NIH has just finished a 4-part webinar series talking about the increase in obesity-related cancer in young adults. So clearly, parents need help, families need help, and how can we help them? The other thing that I'm sure everyone on this call knows is how much it costs us. You know, it's very, this disease is very expensive, and it's costing, you know, businesses are suffering, and the costs are astounding. And one of the things that I've also noticed that's happening in the last couple of years is that parents are having a really hard time navigating these body size and shape trends that are happening in our environment right now. I've talked with a lot of pediatricians and people who are helping families with metabolic disorders, and they're feeling the backlash of some of these trends. But my point in showing this slide is that I really think that all of these trends can come together. All of these camps should come together and rally around the children who are facing this, who have gained too much weight too fast and who have overweight or obesity. You know, how can they come together to give that support to families and provide that love and kindness? I think that there's room for all of these perspectives, and I think, but we need to focus on the children right now. And you'll see why in a few more slides. So what is Worthy? Worthy is a program that's really intended to give parents the knowledge, skills, and abilities to care for their child who's gaining too much weight while preventing all those things that we know are happening to them: anxiety, low self-esteem, poor body image. We also know, because we're in the middle of a youth suicide epidemic as well, and then we put COVID on top of that, families are really dealing with 3 epidemics that are affecting how much their children weigh and what size their body size and shape is. And we know that that can lead to isolation, discrimination, bullying behaviors. And we need to figure out how can we help parents keep their child safe at home, at school, and at the doctor's office. We also, one of a taboo topic in our society is that bullying within the home. When I've presented at large conferences about the youth suicide epidemic in relation to the child sexual abuse epidemic, when I begin to talk about bullying within the home, I've had the professionals in the room have to leave the room sometimes because it's a subject we don't talk about that's happening and is affecting our children. So how can we help parents who may unintentionally be calling attention to their child's body size or shape as a way to that they think is being helpful? How can we help them learn a more caring and kind way to do those and address weight gain with children? And it's clear that parents need these skills. Everyone who I've talked to says this is so needed, and they really appreciate the idea that someone's taking time to help them navigate this epidemic. And I think the most important thing that I say repeatedly throughout this program for parents is that you are worthy of love and kindness and compassion. And this really, no one is saying this to these parents who are dealing with these three major epidemics right now. And they need to hear it from us. It needs to be infused into our public health programs. It needs to be infused into our practices. It needs to be infused into every place that touches that child's health and well-being. So what is worthy? There's two components to worthy. The first part of worthy is for parents. And what we're offering right now is a 2-week virtual workshop that includes 4 60-minute Zoom classes where we learn, how do I create a body positive environment in the home? How do I address bullying within my home, maybe between siblings or maybe a grandparent who doesn't understand the childhood obesity epidemic? Um, we learned 5 criteria to help children find and be their healthiest weight. And these 5 criteria are ones that I selected that address the epidemics I just mentioned, but also I've prioritized them for very specific reasons. And I'll show you those after I tell you more about the program. I'm going to give you a sneak peek at the curriculum. Our next class is in June. And what we do is we have our virtual workshop is $99, but now we're beginning, because parents all don't want to be on Zoom. And some of it is such a sensitive topic for parents that we are limiting those classes that are live to just 15 parents. If we felt that was it just feels right. They were able to bond, they were able to get the attention they needed and their questions answered. And it was easy to create a feeling of safety with that many people to discuss a very sensitive topic. Because of that, we're also now offering a self-guided option where you get a asynchronous version of the class, me teaching the class, but you can watch at your own time, at your own pace. And that's $49.99. And again, these are the things that we go over. We talk about that body positive environment. How do I set productive boundaries at home, at school, and at the doctor's office? They learn the 5 criteria. And this is my favorite part of the program. They really develop an action plan. And what I do in this program is I show them the research that says, no, don't talk to your child about weight. That's mostly coming out of the Rudd Center. You're going to cause eating disorders. Especially, you have to have context. You have to understand the child's development stage. You have to understand how you're going to do it and what the long-term implications of that could be. And then I show them the research that says, yes, given the child's developmental stage, and they're at this stage here, yes, maybe you could approach the subject with them. I let them make their decision. If they do decide that they do want to talk to their child about weight, we develop a script. And we also talk about the context in which that script would be delivered and what would be best. We try to use their family love language in that script. But one of the things I do caution parents at that time is sometimes the love language in families is humor. And there's no time at all that humor should be introduced into this conversation. It's a serious conversation that has long-term implications for children. And there's a lot of research that shows that. So I really try to guide them into using words that are true, necessary, kind, and balanced in that script, and then to think about the context in which they will talk about weight with their child. They actually learn about kindness and self-compassion. Kindness, compassion, empathy are all emotions that we need to practice, their acts that we need to practice, and they learn how to begin practicing them daily so that their child's world is becoming infused with kindness and compassion to counter that weight stigma and bias they might be feeling in the environment. And they learn how to set productive boundaries. This is actually my favorite part of the class, and I didn't expect it to be such a big hit, but they develop a back pocket statement. And that's a statement that, you know, when you have felt, for me, I usually feel like a microaggression or a micro assault about my gender, being identified as female. And you get in the car, someone has said something, you get in the car and you're like, oh, I wish I said this, or I wish I had made myself feel safer. They develop that one line that they can immediately make them and their child feel safe. We also talk about different types of microaggressions, how and when and if it's appropriate to address the microaggression, and what that will mean for their children as well. So it's a lot of skills, knowledge, and abilities, but also a lot of what's the context in which I'm doing this. The second part of the program for Worthy is for professionals, because we know everyone has to be on the same page, because we have teams of people who are there to help our child with their weight management. And so what we're currently working with a lot of organizations to offer continuing education credits. The New York State Social Workers Association is on board, the School Nursing Association. So there's a lot of different places that we're looking so that professionals can be trained in this as well and get their continuing education credits. If they choose to do it on their own, there's a self-guided option, which is for $149. And what the professionals learn is they go through the same topics similar to the parents, but they work on how do I bring up weight-related issues with parents, and possibly if they're working with teens, perhaps a teen who they know might be being affected by weight stigma or bias in one of the settings that they're involved in. They also learn the power of kindness, and they also develop an action plan of how they are going to address weight bias and weight stigma in their profession. So I think it's a really, it's a comprehensive program for them. The other thing I wanted to say about the program is I try to make them short. There's a bunch of memes on Instagram right now in different groups, parents don't have time to read, moms don't have time to lose weight. So I really tried to think about the time that people can dedicate to this. So it's very short, it's very focused, and it's very actionable, so that they're not just sitting listening to me talk, they're actually doing activities and internalizing some of this and then practicing it and then having the tools and resources to support it. So our goal for Worthy is to be the #1 body positive program for parents of children with obesity in the US in 3 years, and then globally in 5 years. And we have a great team to try to make that happen. That's myself, is Joanne Stevelos, and then we have and I want to tell you about this team too, because this is a really cool part of the program. During those interactive sessions that I told you about, where the parents show up for 4 classes over 2 weeks, we also have what we call moderators and contributors who can address the specific problems that a parent might be having. So for example, Anastasia is 40 years as an RN. I tell the parents, Anastasia is going to be your moderator that week or that class, come with any questions you have. She can address some of those questions. Meredith is trained in traditional Chinese medicine and integrative medicine. So if parents were wondering, like, does acupressure work, or should I be bringing my child for acupuncture? She can address those. And she also talks about like some of the scams that kind of bubble up in those industries, for them to avoid some of the different herbal recommendations and things like that. They can be useful, but she wants to caution people that they will not benefit weight loss, but they could benefit other things like stress levels and bringing your cortisol levels down, things like that. Then I was so pleased to have Marie, as you met earlier. She is an intern at the School of Public Health and Sciences at UMass Amherst, and she's the one who's helping us craft the language. We want parents to feel safe in this program. We want them to feel cared for. We want them to experience loving kindness and compassion from us and from all our messaging. So she's really working to help craft some of those ads in that language so that parents right from the get-go feel like, oh, this is a place that I won't feel shame. I won't feel that personal failure that some of the messaging in my environment is telling me. I'm so pleased. This is my biggest ask. Brett Harris, who's now the vice president of the New York State School of Public Health Association, she has agreed to be a moderator and contributor, and her expertise is youth suicide, which if parents are worried about their children, she can help not, of course, treat them at all, but guide them towards resources that could help them get help for their child. Adrienne Gill, she is a public health person who's really immersed in organizations and community systems. If there's food access issues, if there's community engagement services that they need, she can help direct people to some of those larger service providers in their areas who can help children. We know that most children don't have access to a whole team of obesity experts to help them, which is part of the problem. So how can you and who can you engage with in your community to help that child? And she'll be helping with parents with some of that. Then Akare Marsara Thompson and Elia Chan are my colleagues from New Zealand, and they really do a lot with youth engagement. How do you engage youth as you're trying to help them with these serious issues? Okay. And this is my favorite part about the program. For those of you who know me, you know I'm very much about health inequities in our community, and I've spent most of my career working on them. And this was one of the sticking points for me of bringing Worthy and launching it was I couldn't figure out how to bring equity into the project. And I finally figured it out because I do buy Tom's Shoes, which is a buy one, give one program. And that's what we're doing here. So this first cohort who took our class in May, who bought the $99 class and who came those 4 weeks, has now given a workshop to Wellness for Greatness in Kenya for free. So we're doing that, and I'm so excited about this. They're gathering parents from the community, and all the staff from Wellness for Greatness will take the Worthy workshop. Kenya right now is having an uptick in childhood obesity, but there's no surveillance, so they don't know the depth or impact or reach of the problem, but they are also seeing an increase in type 2 diabetes in young adults. That is why Wellness for Greatness for Kenya was created, and they become members of the World Federation for Obesity Prevention as well. So we're so excited they're our first Give One recipients. And so one of the things I'm asking everyone is how can we spread the word about this? I'm asking people who are in the health professions that maybe this is a program that you can refer parents to. We want to encourage organizations that are serving under-resourced communities to get on our buy one, give one list. And they can email us here to get on that list so that we can get that equity out into the world here and everywhere. And we also would love to provide professional and development seminars or come in and do continuing ed trainings for you as well. What we're asking employer groups is we're asking them again to refer if they have pediatricians and dietitians, social workers who are working with parents to the program. Offer Worthy as part of your employee assistance program. Make it easy for parents to access this program during their work time. Maybe offer a lunchtime Worthy workshop for all employees. It's not just employees of children who have obesity. It's for all parents because everyone is at risk for obesity. It's not just some people. We're all at risk for it. And so they can also learn about weight bias and weight stigma, which can also help support the parents in their organizations. We offer group rates. So when we talked about that $99 or $49.99, of course, we would offer group rates for that. And we ask the same thing of health insurers. Maybe this is part of their community wellness program. Again, obesity affects everyone. We have 1 in 3 children, and they predict by 2030 it might be 1 in 2 adults in the United States who will have obesity. So this is something that everyone needs to know about and needs to get back on our radar. We saw during COVID that pediatricians have been anecdotally reporting that they're seeing children come in for their yearly visits who have gained 30, 40, 50 pounds. The average adult has gained 15 to 20 pounds during COVID with all that we had to go through with lockdown and also all the food access issues. So I think this is something that if we can teach people about approaching these epidemics and what's happening to all of us with kindness and compassion, that it can bring a lot of good to this world. And I know there's a lot of educators and caregivers and nannies who've been looking at this program too. So we try to train them as they're helping families. And I encourage them to work with the International Nannies Association, who's going to be featuring this program. And I also want to say the county health officials, our Worthy program was featured in your newsletter. And we also want to encourage county health officials to go out to those under-resourced areas and get them on the buy one, give one list as well. And here's what's coming soon for our Worthy vision is to have a certificate program for professionals. We want to have a train the trainer certificate. We want to have a Worthy parent network where I really feel like the parents who are showing up for these workshops are pioneers in trying to figure out how to make a safe space for their child during these epidemics. We've been doing a Worthy online newsletter, but I'd love to see a magazine. One of the things that I'm so blessed with is I have so many experts in my network that I would love to interview so many of you so you can share your knowledge. One of the things that as researchers, we all tend to publish in places where we're not really getting to the people who need the information. And I pride myself on anything that I write. I try to write at a 5th or 6th grade reading level so that I can reach as many people as I can. And that's what I envision for the magazine, is where we're taking all of your beautiful research and making it so that it's accessible to people in a way that is also promoting kindness and compassion. So the research will be the findings, but how does the findings help promote kindness and compassion in people's lives? And then my real hope for this is that this can just be an app for parents as well, so that they can have all of this knowledge right wherever they are in the world and be able to feel some of this connection and attachment quickly. And here's what one mom said, which really warmed my heart. We've had a couple really good blurbs from parents come in, but I thought that this really spoke to what I was trying to do, and this mom got it, and I was so pleased about it, that we're really trying to give that information, strategies, and researches to build those healthy habits, not just around food, but around our mindsets and how gratitude and compassion and empathy and kindness have just a bigger role in what we eat. And so we really try to focus on some of those things. And this is just a little slide just to show how I present some of the learnings to the parents. And I really want to share this with you too. So this is a slide I often use it's a slide I actually use to develop Worthy, to try to address all these different contributors to energy storage. It's from the Obesity Society, and it was published in 2015. And I was hesitant to show parents this because it's overwhelming. It's overwhelming to me as a researcher. But I was so surprised. Parents have asked me for this. I've emailed it to them, and I'm making it part of our resource offerings. When I show this to them, that immediate feeling of personal shame, failure, however they've come to this workshop, you can see it dissipate. Oh, it's not just about what mom's doing. It's about all these other things. And I feel like this slide actually is like the epitome of kindness. They just felt like, oh, this isn't just what I'm doing wrong. I feel like I'm doing something wrong all the time. My kid keeps growing and I can't stop it, and I don't know what else to do. And when we show them this slide and show what's inside the person, what's outside the person, what you have control over and what you don't have control over, it just begins to give them some relief and some feelings of hope is really what it does. And so I believe that we can cultivate worthiness and kindness in our schools and at home and at the doctors. And as you've noticed, we use sunflowers as our theme. And my reason for this is because we started using lots of pictures of children, but I work all over the world. And I just felt like sunflowers, just one, are so hopeful. I think they are emotive. They create a safe and loving environment. And we just decided to make sunflowers the brand for this. So I just love this, and we've gotten a lot of good feedback about the sunflowers. I feel like we try to bring inclusiveness to it. So this slide here is a slide that how we start the class, which the parents are a little taken aback at first. And then at the end of class, we show the slide. And then I ask them to print this out and put it up somewhere where they can see it and their child can see it. I want to just walk you quickly through what our 5 criteria for the healthiest weight is. And again, I mentioned I prioritized them by what I thought the research showed me is important. The first thing I think parents need to work on with their child, and you notice it has nothing to do with food, is a best friend. A best friend is going to help them feel attached. It's going to help them with bullying prevention. It's going to help them face the youth suicide epidemic. We know that isolation is one of the biggest contributors to suicide. And when children are isolated, they experience that same sense in loneliness as adults. And so if they have a best friend, this is my priority for our children. Parents have said, my child doesn't make friends easy. How can I help them? We have resources, and we do a deeper dive in the second class on how to make these things actually happen, actionable items they can do. How do I help my child have a best friend? And again, why worthy? This is what the best friend is reacting to. This last bullet point, I just want to point out, it's heartbreaking that in the study that showed the increase of children ending up in the ER for attempted suicide or death by suicide, the average age was 13. Just when children are supposed to, 13, when you're just learning your independence, you're trying on new identities, you have new freedoms. This made me so sad that this was the age where they were seeing the most children, and we need to help them. And one of the things I think we can do is really help them. That's also when they're changing identities, they're changing friends, and help them understand how to keep friends through transitions in your life as well. So we talk about some of those things. And then the second thing we know is sleeping has such an effect on obesity. And there's a ton of research that shows this. So we have a lot of sleeping strategies. The parents who have teens laugh at me when I bring this slide up because they're the least compliant people on the earth. And so what we do is we talk about the idea of active rest for teens. How can you get your teen to actively rest so that their cortisol levels come down, their bodies begin to rest, and they have not the exact same benefits of sleep, but they're getting a little benefit of not just moving all the time and not getting that time to regenerate. So, and again, why worthy? Here's all the protein. Here's all the research that shows that reason why we chose sleep as the second. Move often. We know moving helps us with our endorphins, with our serotonin levels. We want to help children learn to move often and early, I say, and define. I'm not talking about team sports with them. I'm just talking about how can we get them to move. And again, there's tons of link between physical activity and good academic performance and all of those things we know. And then the next thing we want to do is help them feel safe at school, at home, and at the doctor's office. And this research, I think, is the most important way in why we spend a lot of time on kindness, compassion, their script, how to stay safe at the doctor's office, how do I make sure my child's not weighed every time they go to the doctor's office? If they do get weighed, how can I control that and make it a positive event and not a negative event for the child? Um, we know that there's weight discrimination throughout the healthcare system. And I know I have a lot of doctors who are friends, and I know they are kind and gentle to their patients, but there's still a lot of training that needs to be done on how to, besides motivational interviewing, how do we also keep a body positive environment in our practices. That landmark study I showed you in the beginning about the quality of life for children with severe obesity versus children who are undergoing chemotherapy, that again was my biggest why for Worthy, that we need to care for children with metabolic disorders the same way we care for any child who's ill. Nurses, I thought this was astonishing, that these attitudes are still prevalent in the medical system. So parents really learn how to get that quality of care. But what I do is I show them what this is my bioethics training. What level of care, standard of care should you be expecting? And how do you make sure that your child's getting that standard of care? And what is unacceptable care? And how then do you get better care for your child? And we make a plan if that's what's going on with them. And this is the last thing we talk about is food. So most foods prevent type 2 diabetes and hypertension, and we talk about what that looks like. And again, this is also my last reason of why Worthy. I felt like with the COVID pandemic, parents were so in need of something. There was so much more talk everywhere about people gaining weight, and not in a positive way. It was all negative, it's very negative talk. How can we now really help people? And maybe this is the impetus for it. Worthy has a framework for 4 theories. We have hope theory, which I work with Dr. Anthony Scioli. We are opening up a Hope Institute this year, which I'm really excited about. We just finishing up our 501c3 paperwork for that. I also use mindfulness theory, behavior change theory, and self-efficacy theory. Is all infused in this work. And I just want to give you, because we have a few more minutes, I just want to give you a little flow of some of the slides the parents see, so you can just see. We do shift from when we're talking about a serious topic, so hope versus mindfulness. So this is like, some parents are feeling hopeless, right? So sunflowers wouldn't be. We want to be sensitive to their emotions. So we start to use poppies and different more serious looking flowers. We talk about how hope is future directed, and it has these 4 channels. They learn about these, and how each of these channels has to be equal. So we really want to have children be attached. We want to have them have some mastery. We want to have them understand survival. And we want to have them understand spirituality. And spirituality in the most, this way I describe spirituality is that thing that you do, that thing that I say to myself, that thing that I feel that makes me feel that the universe is benign. So that's a lot of different things for people. Could be riding a bike, could be going to church, could be on the golf course, could be playing basketball, could be walking in the woods, could be meditating. It's whatever that thing that makes the universe feel benign, and also that you lose a little sense of time so that you can feel connected to everything around you. Mindfulness, as we know, is maintaining that moment of awareness. And then we talk about, does the discussion have to be this or that? Everyone's talking about mindfulness. Is that the answer to our issues? No, each of these are emotions that need to be strengthened. They're actions that need to be strengthened. And so they serve different purposes at different times in our life when we're helping our child. So we get into that. We talk about why they're beneficial, how hope is beneficial. I bring them through all that. And then we talk about our language. And I really reflect on this language. This language comes from Thich Nhat Hanh. Are my words kind, balanced, necessary, and true? Is my intent to relieve suffering and to keep my child safe and cared for? If I am trying to help, is what I'm saying factual and helpful? Am I using age-appropriate information to help my child feel safe and loved? Is everything I'm saying to my child necessary for them to feel loved? We really focus in on that, and this is how they develop their script after they learn these things. And we learn how to practice kindness, and we learn why kindness is good for us. We learn why gratitude is good for us. And then they spend their last class really working hard on developing their action plan, so they leave. After they leave class, we trickle out. For the first 5 days, I send them a little note reinforcing some of the things they learned. Then they get an email every week, then every 2 weeks, then every month, so that there's some momentum, because that course is short. It's just those 4 classes, so it's short. So I just feel like that follow-up can help reinforce some of that. And I just wanted to just give you a little feel of where this research came from. These are some of my favorite researchers who I've